We are paying special attention to a particularly vulnerable part of the population, children. We've been talking a lot about this over the last few days. The Omicron surge is putting children in the hospital in close to record numbers. Most, we're told, are unvaccinated. But there is some optimistic news. The CDC revealed today 3 new studies showing vaccines are safe for children and highly effective against COVID. Joining us now is Dr. Claudia Hoyen, Director of Pediatric Infection Control at UH Rainbow Babies and Children's Hospital in Ohio. Doctor, thanks so much for taking the time.
Mr. Lipoff, thanks for having me.
You can call me Phil. Let's dive right into these. Let's dive right into these studies, okay? The CDC offers some insight as of the effectiveness of vaccines for children, as nationwide, on average, pediatric hospitalizations are up 40% in just the past week. You know this, of course. The second study was conducted when Delta was the dominant strain, found that the Pfizer vaccine was 92% effective at preventing infections. This was in a small study of 243 children ages 12 to 17 out in Arizona. What do you think the importance of these studies is as we continue to make our way through this surge?
I still think that it's really helpful to understand the data. Even though it was Delta, we do know that getting boosted can be very helpful against the Omicron. And so to know that these vaccines are safe and effective is just really important as we're moving into this next phase, so that if there are parents who are still debating whether or not they are thinking about getting their children vaccinated, now's the time to speak with your physician, because we have this really great data. As you said, we know that the vaccines are effective. I believe the CDC also, as you said, published some data on the side effects of the vaccine. I have not had time to read the entire article yet, but they were saying that as we had presumed, the side effect rate in the kids that were 12 to 15 was very low. And the side effects that parents were seeing really, sore in the arm, fever after the second dose, maybe some headache after the first and second dose. And those things that we worried about so much with the older population, the myocarditis, really was very rare in this group. I think they were talking about 8 million children that they were following who were vaccinated, and that there were about 11 cases of myocarditis. So again, knowing that myocarditis from COVID is so much more serious, the chances of getting myocarditis from the vaccine is very low, and also those children recover.
The county where you work has the highest number of cases for children under the age of 18 in the state right now. That's according to the Ohio Department of Health. I have a couple questions on this. First of all,
Sure.
What kinds of symptoms are these kids dealing with who are coming to the hospital? We're talking about more hospitalizations, but what are you seeing? Is it trouble breathing, high fever?
Yeah.
What are you seeing?
All of those things. As we know, with each variant, some of the symptoms have kind of changed over the last 2 years. In the beginning, there were lots of kids with GI symptoms. We've had a lot of loss of taste and smell. And in the last couple of weeks here in Cleveland, as we have started to see the Omicron variant, the thing that we're noticing is runny nose, headache, and fever. Those are really the 3 big things that we've been seeing, not only in our primary care settings, but in our emergency rooms, our ERs. And then as children have been coming into the hospital, typically the reason that they're needing to come in is either they're dehydrated, but also they're having respiratory symptoms. We have some children on oxygen. I can say over the last day or two, we've certainly seen an uptick in our ICU admissions. And so as I was looking back to where we were last week, I think that we are really on the start of an uptick here in Cleveland for hospitalizations.
Oh, that's
Certainly,
good to hear.
We've already had an uptick in cases.
Doctor, one final question. We're hearing that Israel is going to be vaccinating some of the most vulnerable in that country. I know it's a different country. I know they're different scientists, but doctors here do kind of look to Israel for guidance in that sense. Do you think a 4th shot, A, is a good idea, and B, is going to be coming here soon?
I think right now the important thing is to get as many people boosted as we can. To get as many people who haven't been vaccinated, get them done. I don't know what the bandwidth would be to start a fourth shot for people, since most people have just recently been boosted. The thing about Israel is they were a couple months ahead of us in terms of boosting. So I'm not sure we're out long enough from most people who've been boosted yet to require a fourth shot. I know that the FDA is also looking at recommending a booster for kids 12 through 15. So again, we have certain populations that I think we need to get done first. And then as we're approaching a little bit more time out, I think we'll have more data as to whether or not a fourth shot would be recommended here in this country.
Fair enough, Dr. Claudia Hoyen. Thanks so much for spending time with us. Appreciate it.
Thank you. Be well.
You too.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.